Hello everyone, welcome back to this specific channel. Today I'm going to take you through medicine supplies management. Under medicine supplies management, there are a number of things that we are going to look at, and that takes us to the outline of what we want to cover. So the first thing that we need to have is what we call the rationale for medicines management. What is it that we have to put in mind when we are managing medicines? And then overview of medicine management cycle. We are going to look at the cycle. Components of medicine supply management system, where we have selection, procurement, distribution, use, policy and legal framework, and then management support. Why manage medicine supply? So we are going to look at the financial objectives, why we manage medicine supplies, operational objectives, and then customer service objectives, as well as health objectives. After that, we shall look at the benefits of efficient medicine supply management system to patients and facilities. Then we look at implications of inefficient medicine supply management system in a specific facility and then to the patients. So let us look at medicine and medicine supply management. Medicine management is a set of practices aimed at ensuring the timely availability and appropriate use of safe, effective, quality medicines and related products and services in any healthcare setting. Medical commodities are medicines and then other hospital supplies used in management of patients. So we have medicine and medical commodities. So medical commodities are other things that we use, or hospital supplies, for example, can be cotton wool, can be gloves. So you find that they are not medicines, but instead they are other supplies that we need to take care of or be in charge of. Okay, so that is what we need to know. So medical commodities include medicines, medicine equipment, and then supplies, where I said gloves, masks, and then stethoscopes. We have gauze, cotton wool, and surgical equipment. So these are medical supplies. So whenever we interact with the word medical supplies, we have to appreciate that these are some of the examples. Medical equipments are the instruments that we use, maybe for diagnosis of the different conditions that our patients may present with. And then the medicines are the drugs or medicines that we give to a patient in order to manage a specific condition that a patient has been diagnosed with. Then we have laboratory supplies and equipment such as diagnostic kits and then reagents. So those are things that we are going to manage. We are going to see how do we get them, how do we manage them in the store, or how do we manage them in the facility, what do we need to put in mind when we are managing them. So those are things we need to know, the things we are going to manage before we look at how do we manage the things, because we needed to appreciate the fact that there are different categories of medicine commodities that we have. So what is the rationale for medicine supplies? The rationale is what is the use or what is supposed to be put into consideration to make sure that our medicine supplies are not wasted, are not put into waste. Okay, so we see that the rationale, it ensures the right commodity or right medicine is given for the right condition or for the right diagnosis, and then the right quantity. The medicine or the commodity should be given to a patient to treat the right condition. The right quantity should be in the right quantity, the right place, the right time, and then at the right cost, and should be to the right patient. Okay, so after a medicine should be given for the right diagnosed condition and should be at a given quantity. Of course, the quantity we are looking at the dose. It should be given at the right dose at the right time and then the right cost. Okay, so that is the rationale for medicine supplies. So this refers to the 6 rights of logistics. So the 6 rights is the right commodity, right condition, right quantity, right place, right time, right cost, and then we have right person or patient. So that is the rationale of medicine supplies. So we have the basic principles of medicine management. There are principles that we have to put in mind when we are managing medicine. 1, determining which medicines are needed and in which quantities we need them. And then we have purchasing of medicine. We have receiving and checking of medicine. We have storage of medicine. We are going to look at this in details. And then record keeping. Record keeping, storage of medicine, receiving and checking, purchasing of medicine, determining which medicines are needed. Of course, the procedure of determining which medicines are needed, we are going to look at it. It is called selection in the next slides. So these are things that we have to put in mind when we are managing medicines and medicine supplies. You need to select whatever supplies or medicines that you require in the facility, and then after you have selected or identified, we can use the correct word we can use is identified. After you have identified them, you purchase them, because you're not going to manage something that is not present or that is not there. You cannot have a store, or you cannot manage an empty store, or you cannot manage an empty room. Let us call it a room. So you need to first have things in it. So when you need to select the things that you need in the facility, and then after you've selected, you need to purchase those things. After you've purchased them, the supplier is going to supply for you. So you receive them and check whether if whatever you ordered for has been delivered. And then after that, you have to store them and keep the records of whatever you are storing. So these are the basic principles that we are going to look at in medicine management. There are basic principles that we shall focus on in medicine management. So let us look at the overview of the medicine management cycle. Medicine management cycle involves 4 main elements. We have selection, procurement, distribution, and use. 4 main elements. However, we have other elements, that is management support. When you look at management support, we are looking at the skilled labor, the people who are going to work or who are going to manage the medicines, and then how they are going to manage. So that is the management support. People who are helping us procure, people who are giving us money to procure, that is the management support. Policy and legal frameworks. We have a number of policies that regulate selection, that regulate procurement, that regulate distribution, as well as use of medicine. So it is the real cycle, or an element is based on our previous elements, and is as follows. So we are going to look at the next slide. We see that we have what we call the management cycle. So when we look at the management cycle, we said we have four major elements, that is selection, procurement, distribution, and then use. Management support is what we are calling organizations, people who are financing for these other elements. And then information management, people who are giving us the information, who are keeping the records. And then we have human resource. Okay, human resource is responsible of recruiting, selecting the different personnel that they require in the place, and also managing the welfare of those clients or those workers who will enable us or who will support us when we are selecting, when we are procuring, when we are distributing, as well as use. So human resource is a broad body, management body that deals with a number of things. Okay, so these are the main things that we have in the cycle. Let us look at each of them at a time. So we start with selection. Let us start with selection. So we see that in selection involves reviewing relevant health problems, identifying treatments of choice that we have for the relevant problems that we always experience in the community or in our facility, choosing medicines and dosage forms, and deciding which medicines to be available at which level of care. So this selection or this management of supplies can happen both in private sector as well as public sector. However, how public sector selects their medicines may not be the same way as the private sector selects, because most of the private sectors may have donors for their specific medicine. So you find that most of the logistic or most of the management, most of the selection is done putting in mind that some of the products or some of the medicines are going to be delivered or they are going to be donated. Okay, so with the public sector, selection is done nationally to determine which items should be available at each level of care. With the private sector, we see that sometimes are left out of national process, so they do their process individually. Selection is left to each facility or organization. So selection, what we need to appreciate, like from the word selection, we are identifying what do we need in the facility. So when we look at the facility, is based on providing care, that is a patient-oriented type of care, whereby the main goal is to make sure that the patient moves out of the facility when they have got the right treatment for their condition. And in case a facility cannot handle, they will have to refer the patient. So identifying the health problem, knowing which treatment of choice can be used for different problems, enables us to know which medicines or classes of drugs shall we need, what are the medicine supplies that we need in our facility, and a number of things. So the first step of management cycle is selection. We need to select the medicines that we need. Okay, so let us look at the second thing in the management cycle, which comes to procurement. After you have selected the medicine, there is need for us to identify the specific suppliers. So you see that procurement is a process of acquiring appropriate quantities of the needed items. Procurement can be through purchase or donations, and then this is done by various levels. This is majorly for the public sector, where we have the national level, where they procure, the country decides to procure for all its facilities that they have in the country. Or we can have regional level, where different regions procure for their region, for all facilities that they have in the region. And then facility level, with facility level we find that we are procuring based on the facility, what the facility requires. So the facility is given a budget, and then they select what they want. They determine the quantities of what they want, and then they use the funds appropriately based on what they want. Okay, so procurement, we are identifying the right supplier who is going to give us the medicines at a favorable price and should be of quality. So there are different methods of procurement that we can have. However, we need to appreciate that when we are procuring, we are preparing to have those products. We are identifying the supplier, and there are different methods we can identify suppliers. And then there are different conditions that will enable us choose a specific supplier. I can call it choose or go with a specific supplier. Just like when you go to the market or supermarket, you find that you may go to two different markets or grocery stores, and they may have different prices. Or you find that their customer care may be fair compared to the other. So you find that you become a regular customer of a specific grocery store just because of the customer care, or because of the discount they give, or because they are reliable. You get everything in that specific area other than moving from one area to another. The same happens with our medicines. We need to look at the different terms and conditions of a specific supplier, that is what a supplier offers for us. Do they always offer quality medicines? Are they ready to transport for us the products? Are they giving us any discounts? And if they are giving us discounts, are they able to supply for us in time? Because we want to avoid having days out of stock, having days when we have no medicines in the facility. So we continue with procurement. We see that procurement includes a number of items, or there are things that we have to put into consideration when we are looking at procurement. Procurement involves quantifying medicine. Quantifying of medicine requirements involves identifying the quantities, estimating the quantities, and then estimating the rightful costs for the specific quantities. That is a quantification. We are estimating a specific amount or numbers of the medicines that we require. It involves selecting which method. As I was saying, we have different procurement methods. So we find that we have to select a specific procurement method, and then establish contract terms with a specific supplier that we have chosen, and then we have to adhere to the terms. Like we sign a contract with a supplier after we have seen that the terms and conditions for this supplier are similar to ours, or they are favorable. Just like I was saying, if they give discounts, if they are giving us transport, if like those ifs, like what makes us choose them? Is it the ability to provide quality products? Is it the ability to give us good services? Is it their customer care that we are considering? So all these are the contract terms we are looking at. And then after you have settled out the contract terms, you ensure that we adhere to the contract terms. Both the supplier and us, the facility, have to adhere to the terms. If the supplier says we shall always supply for you medicines, maybe in a quarter interval, quarter is 4 months, so they should always give us in the quarterly time, like after every 4 months. We should be expecting, in case we place the order, we should be expecting the products to be there. In case we sign the contract that we shall always procure, or we shall always receive medicines every Monday, so the supplier as well as us should adhere to it and make sure that we procure enough, we have enough which can sustain us to the next order time. Okay, so that is ensuring adherence to terms. And then assuring medicine quality. We should be sure, even if they are fair, they are cheaper, we should be sure of their products. Are they of quality? And if they are not of quality, we cannot settle for less. There is need for us to know what we want. Okay, so that is what we need to consider under procurement. So that takes us to another element of the not periodic. Sorry about that. Another element of management cycle, which is distribution. So we see that distribution is a complex process that involves transferring or transporting medicines and other health commodities from one point to another. It involves clearing customs, stock control, store management, and delivery of medicines to depots and facilities. So a quick one on distribution. We are looking at how does the medicine reach the final consumer. and our final consumer here is the patient. Okay, so we see that the wholesaler or the manufacturer transports to the wholesaler transports it to the retailers, and retailers are the facilities. Okay, and then how do we transport this medicine to our patients? How do we make sure that it is available at all times for our patients to be in position to have the service given to them? So that is the whole distribution. So we have distribution in stages, where we have the manufacturer distributing to wholesalers, wholesalers distributing to retailers, and then now the retailers, how do they distribute it to patients? How do they give it out? Are they giving the right drug for the right condition at the right time, at the right dose for the right patient? So all that has to be considered. And then distribution has a number of types or methods that we are going to look at when we focus or when we zero out on one aspect, and that is distribution. So we are going to look at distribution alone as a different topic, and then we are going to talk much about it. However, for now, we need to know what it does, how it happens, and the rest. Okay, so that takes us to the fourth element of the management cycle, which is use. After medicine has been selected, procured, distributed, a client now has to use it. So use includes diagnosis, because we said medicine commodities can be medicines, medical equipment, or medical supplies, as well as the reagents. So the reagents and then the equipments can be used to diagnose. Okay, and then we have prescribed. The medicines have to be prescribed. After diagnosis is known, there is need for the drug to be prescribed or medicine, and then there is need to dispense or give this medicine, distribute the medicine. Another word we can use for dispensing is like distribute. Layman's understanding of dispensing, we can say giving out to the patient, distributing to the patient, and then proper consumption. After patient has received the medicine, the patient should be in position. To use the medicine appropriately based on the instructions given by a medical practitioner. A patient should be compliant. A patient should adhere to the treatment that they have given them. Okay, so that is proper consumption by the patient. And then medicine use can either be rational or irrational. So we are going to look at what is rational use of medicine and then what is irrational use of medicine. So let's start with the rational use of medicine. What is rational use of medicine? So when we look at rational use of medicine requires that patients receive medicine or medication appropriate to their clinical needs. If a patient presents with malaria, a patient should be given antimalarials. A patient should not be given antihistamines, because antihistamines don't manage malaria. They are not antimalarial, so the patient should not be given them. That is a right. A patient receive medications appropriate to their clinical needs. A patient receive medication in doses that meet their individual requirements. Okay, so the dose that we are giving, if it is a child, we should know the antimalarial child dose. If it is an adult, we should know what is the dose for adults. And then patients receive medications for the adequate period of time. For antimalarials, we know that the malaria treatment is supposed to take 3 days. So that is adequate period of time. So if we give a client medicines maybe for 5 days for antimalarial, we find that we are not following adequate period of time. Okay, so we need to always follow the adequate period of time for us to consider that there has been appropriate use. Another word for rationale is appropriate use of medicine, the right use of medicine, the right purpose of medicine. Patients receive medication at the lower cost to them and their community. So that is for rationale. You need to see that the patient has received the medication, and that medication is treating the right condition at the right time, at the right dose, in the right place, at the right cost, and should be the cost that a patient can be in position to afford. So let's see what irrational use is. Inappropriate use. Since rational is appropriate use, the right way of doing things. Irrational is the wrong way of doing things. So you find that we get the opposite of all the points that we put up. One is wrong medicines are used, ineffective and unsafe medications are used. We have effective medicines are incorrectly used. Medicines are used when they are not needed, or we have too many medicines are used to treat the same illness. So we find that that is irrational use. It is the wrong way of doing things. It is a wrong way of using the medicine. And that we have another component of the cycle where we said management support, and we gave a number of things that we have under management support. It is at the center of the cycle. It functions, holds the cycle together. So you find that we need management support in selection, we need management support in procurement, we need management support in distribution, we need management support in use. That is why it holds the cycle together. So this may include the financial operations, management and coordination, quality assurance of medicine, information management, monitoring and evaluation. So that is what the roles or the functions of a management support. They are managing the finance, they are managing coordination and managing within the facility and coordinating with the suppliers and the rest of organizations or donors in case our facility is supported by donor, something like that. So management support, we are still elaborating on it, where we said it involves good record keeping to provide information. So we need the support to be in position to record or to help us take track of whatever is happening in the facility. How much we have in the store, how much has been taken out of the store, how much have we selected, how much have we procured, how much did we procure and they have not yet distributed for us, how much is on the way that they are promised to distribute for us. Those are things that the management support has to follow up with. Adequate financing is another one. They have to look at, do we have enough money to make sure that we acquire whatever we require. And then staff is adequately trained. So they also make sure that in case there are new ways of practicing, they also have to train the staff, okay? Or they should always have trainings that keep the staff updated so that the staff don't mess up, okay? Because every time things keep updating because the world is changing and technology is coming in, so people need to embrace and appreciate technology. Then we have programs that is well planned and involves community. So that is what the management support is based on or deals with. The other one we had is what we call policy and legal framework. The entire cycle rests on a policy and legal framework that establishes the mechanisms for each function and supports the commodity management cycle. Policy and legal framework. It is important to be familiar with the policies and legislation relevant to medical commodities. where we have the different policies, the national policies. We have quality requirements. Before we order for medicines, we should know what are the quality requirements, so that in case we order a substandard compound or medicines, in case the law catches up with us, we shall not be caught offside. So we need to be aware of the environment. We need to be aware of the legal framework. We need to be aware of what the National Drug Authority recommends us, because those are the different legal bodies that we have. Then we have product registration. Before we order or make contract terms with a supplier, we need to be aware, is this supplier registered? Is he known? And then if there is not is registered, are his or her products registered? Because products that are not known or that are not registered, we may not guarantee the quality of those products. And in case of any deterioration of the quality in the store, we may have no one to report to, because first of all, the product was not registered. And then we have patient legislation, importation requirements and taxes. In case our facility has to import, for example, when we are procuring as a nation, there is need for importation to take place. Importation and taxes, which control the entire products into the individual countries and can have significant effects on costs. And then we have health rights and access to treatments. Okay, so we see that the management support still continues, or the cycle continues, and they are trying to elaborate, which we have already talked much about them, items needed, and then the rest. You find that we have discussed this already when we're looking at the. So let's see the summary instead. So a wide selection of medicine commodities underlies all other improvements, and then effective management saves money and improves performance of the system. Management support is important to the process to be successful. So we need the management support for things to work. Without the management support, things are not going to work. Okay, so that is in summary what we need to put in mind. If we select well, meaning we shall not have things out of stock, we shall have commodities at all times, and the rest. Objectives of managing medicines. We have a number of objectives. However, the ones we have that we are going to focus on in this lecture, we have health objective, we have financial objective, we have operational objective, and then customer care or customer service objective. We are going to look at them one at a time, and we are starting with health objectives. The primary objective of running a health institution is to improve the health of the population. So the health outcomes will be low if needed medicines are not available. So our main purpose or focus is to make sure that people get better. So we need to bring whatever people need in order to get better. So if we do not bring what people require to use, you find that people will remain the same. People are not going to get better. We are still going to get overwhelming conditions or overwhelming issues of the same scenario, yet we would have prevented or managed them if we had the medicines available. Additionally, treatment guidelines are also developed within the management cycle, which lead to improved health outcomes through rational use of medicine. So, by knowing what we have in the facility, what we selected, we are able to know that which appropriate medicine is available for my patient to take it, and we are able to choose the specific treatment choice for the patient. The financial objective, it has been shown that good medicine management can save resources, which is crucial in setting their resources. where resources are scarce. This involves lower prices through different procurement methods and then planned orders. And then we see also it is improved distribution system and limitation. So with the financial objective, we are looking at the finance. How do we manage the money? If we know we don't have enough money, so we are going to utilize the little we have to make sure that we don't waste it. Even if we have enough, we still don't have to waste it by bringing what is irrelevant to the facility, by selecting what a patient is not going to consume. We can give example of maybe the Western countries, the European countries. Some of them may not suffer from malaria because they don't have the mosquitoes or the pests that transmit, the vectors that transmit malaria. However, in Africa, we find that it is a common thing because we have the vectors. So that you find that if we have someone managing the medicine supplies in the Western world, they may not select medicines for malaria because first of all they don't get those conditions. So if for example we are not managing our resources well, you find those people would be also procuring for what conditions even they don't have in their region. Okay, so you find that they are wasting resources, they are buying things that they will never use and they are going to expire in the facility. So when they expire in the facility, still they will have to incur the loss of that medicine or those products, as well as the loss of space. They have wasted space for stocking them, yet they were not going to use it. And then they have wasted time, they have wasted money, they have wasted money for disposing of the expired medicine, because there will be need for them to dispose of the medicine. So let's look at operational objectives. Medicine management cycle demonstrates that each function builds on a previous function and leads logically to the next. This implies that proper management of different functions will improve operations of the next function, and therefore the cycle as a whole. So we find that proper selection leads to proper procurement, leads to proper distribution, leads to proper use. If there is inappropriate selection, will lead to inappropriate procurement, that is what we are looking at operational objectives. In summary, members. Customer service objectives. You see that with the customer service, most of the clients, when they come and they find whatever they need in the same facility, they feel comfortable. However, if we keep telling them this is out of stock and they need to go and get them from other facilities, it really discomforts them. Okay, so we see that customer service in a hospital are to a large extent assessed by availability of medicine. With good medicine management, it is good to reduce stockouts, like having medicines out of stock, and then improve availability of quality medicines at affordable costs. This will improve customer satisfaction and increase frequentation of services. They will always want to come because they know when I come there, I am going to get everything that I require, and then I move out once. So benefits of efficient medicine management to patients. We see that the right medicine is given to the right patient at the right dose, and then medicines are of acceptable quality, sufficient quantities of medicine, consistent supply of medicine, and then in timely manner. So these are the benefits. The right medicine is given to the right patient at the right dose, at acceptable quality, sufficient quantities for a specific period of time that a client is required to take the specific dose, and in a timely manner. You find that they are guided on how they have to swallow the medicine. So we continue with the benefits of efficient medicine management to patients. Managing medicine leads to improved treatment outcomes and health indicators. The population, patients do not lose working hours due to illness, and then patients will consistently seek health care and reduce morbidity and mortality. So those are benefits, right? So benefits still continue. The population will have the trust on the facility. Improved management of medicine will save financial resources. We shall have little financial loss, and then the facility will enjoy the smooth running of operation. Even you, as someone working in the facility, you find that every time you are going to work, maybe medicine's out of stock. So sometimes you just go and sit and wait for that time to reach for you to sign out. So you find that work doesn't become entertaining, it becomes instead boring for some people, and then they will focus on social media and other things. Of course, social media is not bad, depending on the time you give it and what exactly you are picking out from whatever is presented. The facility can attract donor funding through efficient running of operations. People will get interested in your facility because they are seeing it running smoothly. So they will be interested in supporting so that people in the community get better services. Implications of inefficient medicine supplies management. Of course, this will become the opposite: wastage of resources, losing of lives, unavailability of medicine. We say we have days out of stock. We have a number of things, just the opposite of the rest. But let's go through them. Wastage of resources. This can be in the form of availing inappropriate medicines which are no use to patients and the facility. Unavailability of medicine. This will be due to the delayed sourcing of medicines and inadequate amounts being requested. Available medicines may be stored inappropriately, leading to damage and theft. Okay. All right. I want to thank you so much for listening and for coming this far. If you came this far, it means you liked or you enjoyed the lecture. I want to thank you, and I request you to subscribe to this channel for more videos like this, and then send me a greeting so that I can know which city you're watching from, so that in the next video we can give you a special greeting. Thank you so much.